Hi, I'm Danielle Spurlock, and this is my video on sterile wound dressing and donning of sterile gloves. I will go in the patient's room and identify myself and identify them by using two patient identifiers. I would use GPSP, sorry. The 11 rights, the 3 checks. Ask the patient if they're in any pain. If so, I'll give them medication 30 minutes prior to the dressing change. I'll ask them if they have any allergies, medication, latex, or adhesives. And then we'll get started. We will do hand hygiene. Don some clean gloves. Do the push-pull technique. As we push on the skin, we pull back the tape all the way around. If the bandage is sticking to the wound, we can use sterile saline to loosen it, pinching from the middle, pulling it up. We'll use the taco method to document any type of, the type of drainage, the amount, the color, and the odor. And dispose of that. And then we will check the wound for any redness, swelling, any openings where there shouldn't be, and any healing if there's any indicated. And then we'll doff our first pair of gloves. And then we'll move on to sterile gloves. We will check to make sure they're all right size, that the package is closed, that the expiration date is on there, and it's good to go. So make sure that the cuffs are facing me. And we'll start with my dominant hand first. We'll use our 2 fingers to pinch the inside of the glove and put onto my dominant hand first. Using 3 fingers, I'm going to go underneath the cuff to keep everything sterile. And on my non-dominant hand, pulling down the cuff, the inside, and keeping sterile by staying above my waist and not touching anything other than what I'm supposed to. So at this time, we're going to clean the wound. So we will get in our sterile kit and get our clean swabs. There are 3 in there. You take it and you start at the top, middle of the wound, and go straight down. Take another one and you'll do on the farther side, but not to contaminate your sterile area. You do not want to cross over it. And then the inner side of the outer, top to bottom. I don't know, I swiped it like that. And then we're going to dry it. So we'll get sterile tweezers and gauze, and we'll do the same thing, middle. These things are crazy. Outer. And inner. And I will doff my sterile gloves. And hand hygiene. And hand hygiene again because I just touched a bunch of stuff. All right, and then we'll get our second pair. Same thing. Make sure they haven't been opened. Check expiration date. Check size. Make sure the cuffs are facing me. And I'm also going to open my cover sponge. Of course, hand hygiene again. Pinch the cuff. Dominant hand first. 3 fingers. Under cuff. Cuff down. Cuff down. Getting my sterile dressing. Putting it over the area. And then I will tape it. With all 4 sides. Maybe. And then I will take a marker or pen and write my initials, date, and time. And then I will doff my gloves, hand hygiene, and document. Thank you.